the session today, as I said, is about just an introduction, CAT Plus, and the components of CAT Plus. And I've got a little just a little image here, and this really very briefly. I don't want to spend too much time on presentations or whatever. I really want to show you the software, and I'm very happy to answer questions or give you examples on things, how to use it. There's a lot more around. I'll show you also where our user guides and other resources are, but just this as an overview. So your PHN, the North Queensland or Northern Queensland PHN, has signed up with Penn Computer System, Penn CS, to get licenses for CAT Plus. Yeah, CAT Plus consists of the clinical audit tool, which you might already know. The newest tool in the stable is TopBar, and then there is PatCat. Now these tools are arranged in a certain order. So the way they work is, if you look at the patient in the middle, that's where TopBar works. It's a decision support tool. It works at the point of care for people that are present in your clinic. It is not working for anyone else. It really only jumps into action if you have people in the waiting room and people in the consult room. The clinical audit tool, or CAT 4 as it's known since July last year, is a population health tool. It looks at a quite specific population, and that is your practice population. Pam, oh, sorry. Hi, Pam. Sorry, I just got to give Pam the phone number, which she probably has that somewhere. Just a sec. Oh, sure, she'll come in. So yeah, the CAT 4 is a population health tool, but in this case, the population we're looking at is your practice. Yeah, so it will look at patients that are extracted from your clinical system and allow you to run all kind of queries and searches and identify people based on your criteria. PatCat, or PAT, stands for the Practice Aggregation Tool, and it is aggregating data from the clinical audit tool. Important there, PatCat being used by the PHN, there are no identifiable patient bits and pieces transmitted when you upload data. So we de-identify the data. CAT does that before it uploads the data, and anything patient related is stripped aside from the patient age in years, the ethnicity, and the gender of the patient. So those are the only things that actually make their way into PatCat. But of course, what also will be there is the HbA1cs and their blood pressures and their diagnosis and all of the other things that you can see in CAT. Yeah, so that's how the three tools are layered around your patients and your practice data and the PHN catchment. Important to know there with CAT Plus, and this is really new to us as well, starting from July last year, we are introducing more and more links between the tools. So for starters, there was a very small connection between TopBar and the cleansing reports in CAT, and I'll show you that in a moment when we look at the actual software. From May this year on, we introduced a new functionality which took us a very long time to get right, because it was a major job to develop, and in particular to test that. But it's called the CAT Plus prompts, and that allows you to create, based on your searches in CAT, a prompt that is displayed in TopBar if and when a patient presents that meets the criteria. Anyway, that's enough theory. Let's have an actual look at the individual tools. So we're starting with CAT, and I would assume most of you have probably seen the clinical audit tool. It's been around since at least 8 years, and it's obviously has grown in functionality and so on, but the basics are still very the same as in the beginning. I'll show you the three main elements of CAT: the extract panel on the right, the filter panel on the top right, on the left, the extract panel, and the reports on the bottom right. The reports is normally what you're after. When you look at your data, that's what you want to look at. To show you a very simple example, and these hide extracts and hide filter buttons are purely to give you full screen of the actual reports. So if we look at something like The allergies report here, most of you again might have probably already looked at that. It will tell you people with nothing recorded, it will tell you about people with an allergy recorded, and also people with no known allergies. In other words, if you switch to percentage, you can see there's 10.5% of my population of 8,334 people have no allergy status recorded, which puts us just outside the accreditation guidelines, but we'll get to that in a moment. So this is a report in CAT, and there's lots of them. As you can see, there's all this big list of tabs on the top there. When you log on to CAT, the first thing you see is the dashboard, and I just want to show you that because it's kind of fairly new, and it's also got some functionality. Hang on. And from the dashboard, you can access quite a few resources that I hope or think that might be useful for you. Firstly, on the left side here, CAT 4, the whole bag, the whole suitcase, that will give you everything. That's what we've been looking at. So this is just loading it again. These are all the reports in there. If you're overwhelmed by what's there, if there's too many tabs and you don't need most of them, you could switch to a simpler one. And there's the daily view, chronic disease management view, cleansing view, and so on. These are all subsets of the full view. It's smaller on screen. You can see the daily view only has about 12 or so tabs in the view, but all of these 12 are of course also available in the CAT 4 view. So the dashboard acts as a switchboard, so to speak. You can jump into different views from there. The other thing that is available from here are links to our recipes and our user documentation, and I just wanted to quickly show that you can just click on here and that will load it. I've got it loaded already, but because we are in CAT, it will jump straight in the CAT functionality guide. These are new, the online version of our guides, since about April or May this year, and I'm constantly working on them. But really, what we used to have all these different individual PDF static documents that you could download and read through. This now allows you to search for one. You can put any search term in here in the search bar on the top right, but it also provides access to all of our tools, not just CAT. Because we're coming from CAT, it's going into the CAT functionality guide, but you could also go to our homepage, which is just help.pencs.com.au, so open up here, and you can see all of the CAT Plus products. PatCat, which is probably not that relevant for the practices, but if you're interested, have a look. CAT 4 is where you find pretty much everything that we have available, user guides about CAT, and TopBar as well. And they have a bit of a structure. The CAT guides, there's recipes, there's also technical documents for data mapping. And TopBar is user guides and technical guides split, because you probably, once you have set it up, you don't really need to do much there. That's why the technical guides are in a separate chapter, so to speak. So, for example, the recipes there, if we click on there, you can see there's 4 different headings: improve quality of care, identify patients at risk, maximize business potential, and improve data quality. So all of these recipes, if you say click on one of the headings, there's only 2 in there at the moment: Cancer Council Victoria, smoking cessation clinical audit, and allergy smoking status not recorded. If you look at the business potential one, you can see there's quite a few recipes there. And all of these recipes, say we're looking at identifying patients eligible for a mental health treatment plan, clicking on there will load the recipe. All of these have a link up here if you want to download it. You can. It comes down as PDF and you can save it or print it, or you could just access it online. That's really your choice, but it will talk you through all of the details. What's the target? Why do we have this recipe? Starting point, from the filter screen, which filter to use under the condition tab, under mental health, click the yes, under the date range, do this, and so on. So really, the recipes are step-by-step guide to quite a lot of different things. Like I said, under all of these headings, patients at risk, there's quite a few in there as well. Patients with a stroke or TIA, not on blood pressure lowering medication, and so on. Have a look. Not now, but obviously at your own, at your leisure. If you find something there, great. If you think, oh, we would really love a recipe on something else, let the PHN know. They can get in contact with me, and it's very easy to add something there. And we've just added about 20 new recipes in the last month, so there's much more to come. Just for people that are more comfortable following step-by-step instructions rather than going and trying everything out themselves. If you find something in here that meets exactly what you need, you'll be set. Basically, you just have to follow the steps. So that's basically from here the user documentation. There's our support number and there's our email address as well. So if you have any problems, not just technical, but also this report doesn't look right or the numbers seem funny, give us a call, send us an email. Happy to help there. So back into CAT 4, into the full view, and what I want to do in this session today, it's really not about the great detail of CAT. I just want to try to give you an overview and also show you some of the links with TopBar and give you a bit of more information about TopBar itself as well. So if we look at the functionality in CAT, the user interface again, we have our extracts on the left, our filters on the top right. Now, with the example I showed you before, we looked at the allergy status, and remember we said 10.5% with nothing recorded, which is a bit high. But to make this report actually meaningful, we have to apply a filter, and I'll get to that in a moment. I just wanted to show you the extract a bit more on this. You can see there's one on the top here from the 19th, today, this morning. The number in the middle column is the number of patients in the extract. So the one that I've loaded is the one from the 6th of June here with the 8,334 patients. It's our de-identified demo data. This is just for my demo medical director machine with 65 patients in there. So that's really all there is to know about this panel here. Normally you would always load the latest one. If it's old, if it's a couple of months old already, you can hit the collect button to run a new collect. I'm not sure if all of you or some of you have the scheduler installed, which does automatic data collection, so that will make that hopefully easier because you don't have to remember to do it. If you're in a smaller clinic, then you can probably just run the collect as you need it. And when I say smaller, anything less than 10,000 patients should be no problem. If you're in a large clinic, say 30, 40, 50,000 more patient records in your system, then it's not the best idea to run this during business hours because, as you can appreciate, CAT will go through all of your clinical systems database and extract the data, and that puts extra strain, more work on your server. If you have a busy clinic at the same time, people might notice that it is a bit slower opening up patients in the clinical system, and that's something to be avoided. Normally, the doctors in particular are not happy if things slow down. So yeah, smaller clinics, if it takes 10 minutes or so, there's not going to be a lot of impact on the business. But if it's a large clinic, definitely not. I wouldn't do this during business hours. And yeah, so that will run through and just extract the data. We extract only patients that are not archived or deceased in your clinical system. So if you regularly clean up your clinical system by archiving patients that haven't visited and so on, your reports in CAT will be much more meaningful because we're looking at the right patients only. There's a number of filters, and I'll get to that very shortly, but to narrow it down and to look at people that you might be benefit from archiving as well, but really the archiving should always happen anyway in the clinical system, and that they all, as far as I know, have a mechanism to bulk archive patients. Yep. And if people have passed away, then again, we're not touching their records either. We do not extract them. So in other words, for this clinic here, these 8,334, these are patients that are not archived in the clinical system, and they're alive as far as we know. So we loaded the data, and so talking about filters, and the report that we've got there, the allergy status report, based on accreditation guidelines, they are interested not in all 8,334 patients, but rather in those people that are active patients here with at least 3 visits over the last 2 years. So what we need to do to make this report meaningful, as in showing the right population, is use a filter here, and you can see there's a filter there that says active 3 in 2 years. You can hover your mouse over it, says patient has visited 3 times in the last 2 years or more. And As soon as you change anything in the filter panel, you get that Recalculate button up here, turn red. I can hide the filter, or you can recalculate straight away. But just to show you that, so what that's done now, it's taken away more than 3,000 patients. And you can also see the nothing recorded percentage was 10.5, now it's 4.5. So in other words, looking at that, they've actually, which makes sense, the people that come more often, that are regular patients or active patients, their records are better up to date. And now we're looking at 4.5% rather than the 10.5%. But technically what we've done, we've actually applied a filter to get the right patient demographic. And that's really important because the principle remains the same no matter what you're searching for. If it's patients with a certain condition that are not up to date with the pathology, or if you just want to know who out of the active patient had no allergy status recorded. So we'll get to some more filter examples in a minute. But you can see here also looking at a CAT report, so the 4.5% or 224 people, if you want to know who they are, you can double click on the graph and that will show it's called the re-identify patient report, and that will show you their details. So this works in your clinic. Now my data is de-identified obviously, but in your clinic you will see their real names, date of birth, address and so on. And because we double clicked on the allergy not recorded slice of the chart, that's what we get. If we do the same thing, say going to the measures tab, and you can see there's the blood pressure results in there. If I want to know who are my 475 patients with blood pressure more than 140/90, you can see that's all the details, and the last columns will show you the actual blood pressure and when it was measured. Yeah, so that's same on all of the CAT reports. Every graph can be clicked on. Every graph will display the information that's based on, depending where you clicked on. So in this case, 140/90. If you want all of them with elevated and high blood pressure, you can't double click. You need to use that export button on the top right because the double click will only work where your mouse is pointing. So that will bring up now, 1,273 patients and also their blood pressures. So that's, as I said, the same on all of the reports. Now, a little bit more on the filters, just to give you a bit of an idea, and I won't go into too many sort of detail about the filters, just so you know roughly what you can and can't do with that. Ethnicity filter, fairly straightforward, I think. If you tick the Indigenous box up top, that will just be any Indigenous patients, or you can specify you only want Aboriginal patients or Torres Strait Islanders, depending what you're interested in. The conditions and the medication tab, they're both fairly similar in that they have sub-tabs, so you could look at chronic, mental health and other conditions, and you can look at heart, medication, respiratory, anti-diabetics, and so on. With the tick boxes in here, the way that works is looking at the respiratory chapter here, that part, we have asthma and COPD listed. If you tick the yes above the line, it means asthma or COPD. Any patient with a diagnosis of asthma or COPD will be included in the filter. If I tick below the line, it will only be people in this case with asthma and COPD. And both still needs the Recalculate button to apply, no matter what you do. So if we do that, you can see we have 16 patients that have both asthma and COPD, and I can show you the disease report on that. Both are listed, and obviously that's the 16, and it's the same in both. So this doesn't show you individual patients, this report. It shows you diagnosis or diseases, if you want to call it that. Total count of disease cases here is the title. 16 people, and they all have asthma and COPD because that's what we filtered for. But it also tells us that 5 of them have hypertension as well. 1 of them has diabetes type 2, and so on. So that's an example there. Whereas if I go the yes option up top here and recalculate, we have 639 people because there's a lot of people with asthma, 574, and 81 with COPD. So that added up together is not quite the 639 because, as we know, there's 16 people with both. So that's an example for the condition filter, and obviously you can also combine across. So you can say I want people with any type of diabetes, and with hypertension, but no renal impairment. So that would be a search that will bring up people with a certain disease profile, also based on an exclusion, saying we want people with this condition, but not with the other one. So that's all possible. And of course, don't forget, we still have that active ticked in here. So everything we do is also still only looking at patients with at least 3 visits in there. You can add medications in there. Remember the recipe example I mentioned before, patients with a stroke or TIA that are not on blood thinning medications. So that would be something you want to look in there, or lots of other things to combine with conditions. We know certain conditions require certain medications, and you can check for one if they're taking it, or if they're taking medication that potentially is a problem with whatever condition they have been diagnosed with. Keep in mind that for the conditions, it has to be a coded condition. If it's a free text entry, we do not pick it up. No system can pick it up. Not even your clinical system will know if you have a free text diagnosis in there that that patient has diabetes. I've got, of course, as we do, a patient prepared here, and I just wanted to show you an example. And we'll have a look at TopBar in a minute as well, based on this. So with my patient here, you can see I've got diabetes as a condition listed, but there's a typo in there, so double I. Medical director kindly tells you actually what's coded and what's not. This is not coded because of the typo in there. If I would have spelled it right as diabetes, then it would actually come up as coded, and MD as well as CAT and TopBar would know that the patient has diabetes. But being a typo in there, or if there's a comment added after a diagnosis, same thing, it's not going to be picked up as coded. So that's the conditions. For the medications, what we look at is only current medications. So if your clinic has a very good work ethic there around medications that are not current anymore, to take them off the current list, mark them inactive or past medication, whatever the term is, depending on the system, then our medication reports will be accurate. However, because from experience I know that doesn't happen all the time. Let me just show you an example here. We'll just clear my filters. There's a report here called medications, and that will tell you the count of patients by medication. So that just is they're not individual drugs necessarily. There are some like aspirin or warfarin are listed, but others lipid modifying, a huge range of different drugs. Antidepressants, again, same thing. And then there's a lot here with none of these. So there's a lot of patients that are possibly taking other drugs, but we don't extract that information. So CAT doesn't pull out everything and then report selectively. We really just pull out what we report against. That's sort of how it works internally. But this one here, the medications per patient, that's always a bit of an eye-opener for a lot of clinics. If you look at that, so there's 376 patients with 8 or more current medications based on the clinical system. And if you look at that report, you can actually sort it by number. So there is one patient here that supposedly is currently taking 34 different drugs. Next one, 25, 24, 23, and so on. I'm pretty sure that that's not actually correct. But the only way to check that, the only way to verify it is for a prescriber, a doctor normally, to actually have a look at that patient's record and then probably see, oh, there's like 20 drugs that that person isn't taking anymore. So, the reports in CAT are only as good as your clinical system. But on the other hand, because you've got your filters, you have all these different reports, CAT makes it actually quite easy to find out where there are possible gaps, where there are problems with your data quality. And we have a couple of other sessions lined up over the next weeks where we talk a bit more about data cleansing and data quality. So I'll definitely will get more into that. But just as an example here, so this one's quite surprising, I guess, for some at least. So we put in this second one here, medications not printed in the last 6 months. And again, we have 107 people here with 8 or more. And I'll show you what that looks, just as a little reality check, really. So we can sort this one as well. And See, this is my one person with the 34. Well, 26 out of those 34 scripts have not been printed in the last 6 months, which tells us quite a bit. And you can see the second person here, 22 out of 22 haven't been printed, 18 out of 18, 15 out of 24, and so on. You get the idea. So really what this means is that on one way it looks like they're taking lots of different drugs at the moment, but looking at that, it probably is not the case. This doesn't give you the solution, but what it does, it points out where there are things that could be improved and certainly could be looked at, by severity. If you look at the 107 here, if you clean those up, you get the worst cases cleaned up because they are the ones probably with the most inaccurate information in their medication in the clinical system. So that's just as an example, but really these two, conditions and medication filters, are used quite a bit. The general tab, is things like active patients, patients of a certain age, certain gender, DVA members, and so on. Again, that depending what you're after, can be quite useful to narrow down the patients that you're looking at. And I just want to show you one more, and we'll just do an example here with the diabetics, and that's all. We just want patients with diabetes, and we're looking at a pathology report, the HbA1c report. So you can see there's 188 diabetics in the clinic with a coded condition, at least, the ones that we can pick up. And you can see the HbA1c results. 12 have nothing recorded, 7 with more than 10, 20 more than 8, and so on. So you could say we want everyone above 7 and we want to have a look at them. The export button, as you remember, that's going to show you the detailed patients and the details of their results. We do provide both the percentage, the old unit, and the new units in brackets, because it's still transition, obviously, but eventually it'll go to the new unit. But if you sort it by date, this is something that is very important to understand the way CAT works. So the oldest result that we have is actually more than 5 years old in here. And being a short-lived pathology test, the HbA1c, this doesn't allow us any statement. So this patient here with an HbA1c of 12.3 back 5 years ago, he in this case could be down at a 6 now, could be up at a 11 still, we don't know. So this is really a very outdated, very old test. And remember, we're filtering, actually we don't, I should add that, if we say we only want people that have visited in the last 3 years, so you can just add that and you can see there's 181 out of those have visited. There's only 7 that have dropped off by adding the that filter. So just to look at those again, the oldest one, still the same. So this person actually has visited the clinic at least 3 times in the last 2 years, but no HbA1c was done since 2011. So why would we even report a result that's so old? And the answer is that the way CAT extracts the data for pathology results, for measures such as blood pressure, weight, height, also for MBS items, we only take the last available, the most recent result, and that's all that we do. So if a patient has come into the clinic every month and had their blood pressure tested every month, or their, whatever else done monthly, we will do a collect today. The result that's reported on is the one from this month. If, like in our example here, the person has visited the clinic at least 3 times in the last 2 years, but no HbA1c was done since 2011, well, the most recent one is this one. That's why we report on it. So if your question is, who never had an HbA1c recorded, then the answer is 9. But most likely you want to know maybe in the last 12 months, in the last 6 months, in any other time period. And this is where that date range result filter comes in. And you can see this, the individual tabs here, the measurements, pathology, MBS items, maternal health, visit types, and digital health. These are affected by this filter. So if we change it to, say, in the last 12 months and recalculate, you can see now this has changed quite a bit. There's now 32, not 9 people anymore with no HbA1c recorded, because anyone outside the 12-month period will be listed in here as not recorded because it's outside of our filter period. Anyway, that's probably all I want to talk about the CAT and filters for now. We will get more into that in the more specific sessions. But what I want to show you now is the connection with TopBar and CAT, and just a little bit generally on TopBar as well. So you can see TopBar is hovering up there, sitting very discreetly up at the top. You can also see I have a patient open, Maureen Andrews, so she's open in my medical director now. Same functionality with best practice. There's no difference between the TopBar functionality and the tool. It's just I've got MD. I'm a bit more familiar with that to show you that today. So you can see there's a couple of notifications. If I close my patient again, you can see, and actually I should open Microsoft as well. With best practice, it's a bit more integrated because both best practice management and best practice are kind of the same. Whereas with medical director, you need to actually have both MD and Microsoft separate programs that have to be running to look at the things I wanted to show you. So we've got Microsoft open. There's people on the waiting list, and they've been there for quite a while, more than 1 million minutes. It's don't even know how long that is, but no one open in MD. So what's happening in TopBar is there are notifications in the waiting room app, and the way that is displayed there is looking at patients that are currently waiting and what, if anything, is missing in their records. So for Maureen here, she doesn't have a gender in her record, no contact number, no next of kin, no Medicare number, no ethnicity. The ones with the green tick, she's up to date, or at least we have information in there in that respect. So you can, from TopBar, there's the option here, adding clinical system, which in this case actually is the billing system, Praxoft, but same thing. So it will open up the patient immediately there, and we can fix those things. There's a couple of other things that we're missing. Phone number, I'll put one in. And if we just save that, and normally TopBar is fairly quick with the updates, so it's already happened in here. So the next of kin and Medicare number is still missing, but the rest has ticked off. So I've just added the ethnicity, the gender, and also the contact, the home phone number. So that's something which is obviously waiting room app is targeting the reception mainly, because that's where the patients present. That's when they arrive in the clinic and they're marked as arrived or waiting in the Praxoft or best practice management. That's where we can pick it up, that they're sitting there and waiting. This second tab in here does actually prompt for clinical items that are potentially missing. So if you look at, and they're sorted by the one with the most notifications sits on top. In this case, my patient here called Mr. Guy or Flynn. Normally you would see a provider and also the time when they're booked for. I've just added mine to the waiting list just by dragging them on there. But normally people are booked in to see a certain doctor or a certain other provider. That will be listed, and also the time they're supposed to come in. So with this here, when you look at the items that we are flagging, you can see there's alcohol, height, weight, smoking, and so on, all missing. Allergy status and diagnosis coded gets a green tick because he does have at least one coded diagnosis, but still a lot of things are missing. These are not things that can be done by the receptionist normally, at least. It's not the right setting there at the reception desk to start asking people about their drinking and smoking habits, and obviously it's also requires clinical access to even enter that information. So what a lot of clinics are doing with the clinical tab in the waiting room app, that they have a clinical staff member, a nurse, anyone really with access to the clinical component of the system, to keep an eye on that app and say if they can see that this patient, maybe he's booked in to see the doctor at, whatever, at 1 o'clock, and he's come 20 minutes early, and he's got all of these things missing. So the nurse might well go out into the consult, into the waiting room, and say, can you please come with me, or we'll do an assessment before you go in to see the doctor. And that's really where TopBar kind of involves everyone at the practice, reception, any practice nurses or other clinical staff, and of course in the consult room. That's where the doctors come in, and that's what I'll show you next. So that's definitely something that is done with the waiting list, not just for receptionists, but also getting clinical staff involved with that. The doctors mostly are not necessarily interested what's happening in the waiting room because they have their own prompts in TopBar, so they don't need necessarily to look at that. And you can actually turn that off if doctors say we don't want to see the waiting room app on here. There's too much happening in my TopBar with coming up, blinking and whatnot. What's happening in my system right now? It seems to go a bit slow. Here we go. So you can turn that off. This little box with the arrow doesn't have a proper name as far as I know. You can see the apps listed. They can just be disabled from here. Okay, not sure where that came from. I must leave it. I hope it's still all there. Yes, looks like it. Okay, so you can turn it off, as I said. The waiting room app, if you wanted to not show it in the doctor's room, anything that's done in here is only for the individual user. So if I disable that, that means I can't see the waiting room app. It doesn't mean the receptionist won't get it anymore. So it's a per user setting. And by the way, I didn't show you that before here. The last tab in the waiting room app allows you to filter. And you can see this is something that we added on request, a prompt for private health insurance. A lot of people have said, no, we don't want to be prompted for that. Turn it off. It won't show up anymore. If I turn it back on, that number 8, I don't know if you just saw, it changed from an 8 into 10 because there's 2 patients that have no private health insurance entered, and that's what it's doing there. I can turn it off again, it'll go back to 8. As the app settings that I showed you just a minute ago, the filters are per user only as well. So it doesn't affect everyone else, just the person who changes it. So we've opened Maureen now in our medical director, and you can see there's a couple of other apps that have notifications there. So this is all TopBar will show you. Just the number in a red circle. We do not pop up things over the screen. If the users don't want to, act on it, if they just want to keep working with a medical director or whatever they do, that's fine. It's like your mobile phone where it says so many unanswered calls or whatever. Unless you swipe down, unless in TopBar you click on it, it's not going to bother you anymore. So these are exactly the same things that we do in the waiting room app, but now we don't list the patients, we list the actual items. So for Maureen, as we already know, the next of kin and Medicare number are missing. All of the other things are in there. Under clinical, she doesn't have an allergy status, alcohol status, or family history. If I click on this add in clinical system, it will actually get me straight to the right screen in my clinical system. So all I have to do is, in this case, if that's the truth, no non-allergies, I'll save it. And I don't know if you noticed, it went from a 7 to a 6 because now the allergy status is up to date. Same for the other items, exactly the same thing. This third tab here is different because we don't show that in the waiting room app. That's purely a tab for the clinicians, for the providers in the consult room. And what we're trying to address here is the issue of items that are free texted in the clinical system. So you can see that we have diabetes and mental health indicated. Clicking on it will actually show you why. She's taking metformin. She had a high HbA1c and a reasonably high fasting blood glucose as well. That's why she gets a red flag in there for the mental health. We just have a script of, this is going to be a long-term prescription of a mental health drug. If she also had a history of mental health therapy plan, then that would be a red flag as well, rather than just yellow. In Maureen's case, remember I showed you that diabetes here, the typo in there before, so we can fix that actually in her history directly. We can also go from TopBar to there by saying add in clinical system. That will jump to a new item because it assumes it's missing. In this case, it's just a misspelled one. So what we do, we put in a proper one. And we're going to not just pick the generic, but the type 2. So this is something that I really like the way in showing this, because until I've changed this misspelled free texted diagnosis or condition into a coded one, medical director did not know that the person had diabetes. Now, the moment that I've changed it, you can see the drug interaction warning with Lexapro, and that might not be an issue, but I think in general, it's a good thing that these built-in notifications and warnings work, because otherwise there's just a lot to think about, and this just makes it easier, these things. So that's changed in here because we added it in there. What's done in here, it's taken out the diabetes because now we have a coded diagnosis. No more need to flag for it. And pardon me. The other thing that's changed, I'll show you that in the other apps in a moment, but I just wanted to very quickly, in CAT, I talked about links and similarities between the two. And when I clear my filters, what it does in here under the data cleansing tab, these are exactly the same things that we do in TopBar. If you look at the columns, these are the items that we prompt when a patient presents to the clinic. But again, as in I mentioned before, CAT is your population health tool. So this is everyone at the clinic, whereas TopBar only acts to the people that are presenting. Missing an accreditation or clinical items, anyone with a red sort of field in there means it's missing something, at least one. So we got 6,486 patients with at least one item missing out of allergies, height, weight, alcohol, and smoking status. And there's even more. So you can reduce the list or you can add more. But again, this is exactly the same as the waiting room app and the cleansing app in TopBar do on a patient that's actually present at the clinic, allowing you to opportunistically hopefully add the information in there. With the the diabetes one that I showed you, indicated diabetes with no diagnosis, indicated kidney disease, exactly the same. So that's really where TopBar and CAT use the same algorithm, the same criteria to show you what's missing, but TopBar does it on the patient when they're actually there, whereas CAT does it as an overview. And you can see at the back here, there's a confirm the condition does not exist. If you go back to the cleansing app, confirm the indicated condition does not exist. Either in TopBar or in CAT, a person can be removed from that particular prompt, that notification, and it won't show again. So it doesn't have to be done in both. Doing it once in CAT or once in TopBar will get rid of that particular notification. So that was just a little sideline. We're nearly out of time, so I'm just going to quickly go through the rest of TopBar. Patient health summary, that's just what it is. It's a summary showing you things like risk factors, immunizations, and so on. There's no fancy click boxes or anything. It really is just what it says, a summary. And the last app in here, the MBS item, and that's where you get related to the patient's age, gender, ethnicity, past history, diagnosis, and also billing history. You get Medicare items that the person is eligible for, or with the green tick, things that might have already been claimed. There's a bit more here. So for Maureen, these things are not relevant. She's not Indigenous. She's not 75 plus. She doesn't need a health assessment for type 2 diabetes risk because she doesn't have a diagnosis of diabetes, and thus she has a diabetes cycle of care on here. Before we changed that from the free text into the coded, there would not have been a diabetes cycle of care in here, but there would have been the risk assessment there. Clicking on this will actually show you the components of the diabetes cycle of care, and it gives you that neat option to enter that in the clinical system. And I'll just show you that for one example with the foot exam. Clicking on here, that will jump straight to the right screen. The diabetes assessment had foot examination. I won't fill it in now because I can't delete it, and I like to keep doing the same thing over and over again. So that spot is the only place we can actually pick it up from. It's part of the built-in diabetes assessment in Medical Rector in this case. I just want to show you, if you want to do this manually to put it into the right spot, you would have to go to clinical, diabetes record, assessment, and then you've got to rattle through 1, 2, 3, 4, an extra 4 screens to get there. By the way, this is the eye exam. There's the foot exam, and here, one more, is the diabetes medication review. So they're between 8 and 12 clicks into the screen, and that is really the reason why most people don't record it in the right spot. If you're using it through TopBar, it's just 1 click away from here. So that's a definite time saver. But the other thing I like, the way we're displaying it in here, you can see that Maureen's got only 5 out of the 11 items done. And if you look closer, you can see there's a lot of pathology missing. All her lipids are missing and so on. So that might well prompt the doctors to say, oh, well, we need Maureen to do to go to the lab to do a pathology request for her lipids or whatever is overdue. On the other hand, Maureen might have come in to get a script renewal or for something else, and in here it says diabetes cycle of care 10 out of 11, and on a click it might show the only thing missing is the BMI or the blood pressure, and that might well then trigger the clinic or the doctor in this case to say, oh well, might as well do it while you're here, and that means they can actually complete the cycle of care with that. Opportunistically, I guess, is the key word there. Patients in the clinic anyway, why not update the record with the missing data? Why not, in this case, complete the cycle of care for the diabetes? And there's probably quite a bit more, but I'm aware of the time. So what I'll do, I'll just unmute you, and so you're back on the line now, everyone. Any questions to anything at all? Everything clear? Fantastic. Was there anything new for anyone, or did I just tell things that you were already fully aware of? Anyone? Excellent. Okay, oh, that's good. There's one. What about any of the practice people that have dialed in today? Is it, yeah, sorry? No. Okay, well, if there are no questions and no comments, I'll guess we'll call it a day for now. And you have the invite for the other sessions, which are a bit more specific. And today was really just a big overview of both TopBar and CAT. The next sessions will be more around, I think there's one on data cleansing, there's one on specific chronic problems, so it'll be a bit more into detail. And yeah, so feel free to log in again and have a look at our user guides I showed you. Just as a reminder, help.pencs.com.au will get you to the main page. Okay, bye everyone.